What's going on, everyone? Happy Tuesday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu, RSV, norovirus, maybe some other virus, I really hope you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues if it is COVID. And if you're sick with something else that keeps coming up negative on the test, I hope you get some answers soon. It is time now for a surprise Tuesday edition of the Virus Update for Tuesday, December 10th, 2024. If you're new to my channel, welcome to my channel. This is where I do virus updates as needed. It used to be daily, now we do them as needed. Sometimes I say what the schedule's going to be, and then sometimes a bunch of things pop up, and I think to myself, well, maybe we should just do an update today. So that's what we're doing today. And what I update on here on my channel is the latest on COVID, RSV, flu, H5N1, as of lately a new virus in Congo, and all those other viruses that can make us sick, because you need to be informed on what's going around. You may see those segments on the news. They tend to do them from time to time. What's going around? Well, you know what? I don't do 30-second reports like that. No, 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 no. We do 15, 20, sometimes 20 plus minute updates on all those viruses that can make you sick. Want to stay informed? Just subscribe down below. Give this a thumbs up. Hit that notification bell. Share this video with anyone you know. And of course, leave your comments down below. Already, we do have several things to look at today, including some numbers from Vermont, and I happen to find another respiratory virus dashboard that I did not know existed. Maybe it's new this year, I don't know. Someone will be able to leave a comment down below, but I found a state that once again has a respiratory dashboard, and to make it even more interesting, it's a state you would not expect to find one. I think you get the idea. It's a red state. So we'll get to that in just a little bit. First off, I have to share this with you from Scott Squires, and I'll probably add a little bit to this as well. Long COVID. Long COVID is major organ damage, brain, heart, etc., chronic illness, and potentially disability. And you know what else long COVID can be? It can also be damage to your immune system. Yes, where you just get sick again and again and again. Raise your hand, leave a comment down below if you know someone who is constantly, post-COVID, getting sick again and again from other viruses. Yeah, it can happen. More on that in just a second. Every COVID infection, even mild, has 10 to 20% risk of long COVID. Regardless of age or health, this is the real danger of COVID. Life altered. There is no current treatment. Millions of people are dealing with COVID. And guess what? Let's go back a little bit. Even mild cases. Yes, I'm hearing so many people right now saying, oh, well, the current wave of COVID is not going to be as bad as JN.1 last year. Okay, okay. So you're going to play it that way. Well, guess what? Here's the deal. You take it now. You go out there and not take it seriously and pretend, well, oh, this year's not going to be bad. I'll be fine. Guess what? You become that one person that gets infected with a mild case. Guess what? 10 to 20%. What if you fall within that 10 to 20% and go on to develop long COVID? You're going to wish you took it a lot more serious. Yes, you are. The only way to avoid long COVID is to avoid getting COVID. That means masking, because vaccines do not prevent long COVID. That's why we mask. So mask up and with an N95 to avoid catching COVID. And that means everywhere, especially in healthcare. I mean, there have been a lot of hospital-acquired infections. And oftentimes I hear people say, well, are they in the hospital because of... We're not going to go there. There was a whole thing back in the day, it was because of COVID, or is it COVID? But the point I'm trying to get at is, back to the mild case again. Someone says, well, how busy are the hospitals right now? People aren't really being... so it's no big deal. Okay, mild case. That means not hospitalized, and they went on to develop long COVID. And down the line, developing long COVID could lead to other things that could send them into the hospital post-COVID. Okay, get where I'm coming from here? Moving on. I could go on there for 20 minutes. I'm not going to do that because there are so many different things that should be said. But anywho, new strain of bird flu is being detected in Iowa. Yes, it seems like the bird flu has a very good, does a very good job at mutating, and it seems it mutates rather fast because I'm constantly seeing these reports of new mutations. I've seen several within just the past few weeks. Not a good thing. If you want to read this full story, I did tweet it out, and I think I will do a small thread on my site today, datareport.info, of today's news stories. All right, this is bad news. U.S. sets Thanksgiving record for whooping cough cases, and this is kind of a loose end that I did not include in previous videos because I just found this story today. I didn't know about this on Thanksgiving week, but wait till you hear this number. At least 364 pertussis infections were reported to health authorities last week, meaning the week of Thanksgiving. It is where we should say. But according to figures published Thursday, I'm assuming that means last Thursday, by the Centers for Disease Control and Prevention, marking the worst Thanksgiving week for whooping cough in recent decades. This tops the previous Thanksgiving record of 228 cases of pertussis, which were reported for the week ending November 27th, 2010. That year, there were 27,550 cases reported by the end of 2010, below 28,167 already tallied so far this year. And mind you, we have the rest of this month, so this number could go even higher. And raise your hand or leave a comment down below. Do you think it will get any better next year? I don't know. I think we're going to probably see much of the same next year. It seems like these things, as time goes on, is getting worse and worse. Remember, I talked about COVID can damage the immune system, but also vaccine hesitancy. I know the media likes to play that card, and let's face it, that is a piece to the puzzle, but it's one of many pieces. UK doctors and nurses with long COVID to sue for compensation. Oh, this is not. This is interesting. Long COVID forces health staff to quit work. Yes, there have been a lot of people that have left the healthcare profession, even though I just heard on the news the other day, I think it was on the radio, some healthcare systems are saying, we actually have more nurses now than we did before the pandemic. Okay, all the ones that have the more experience, a lot of the ones that have experience, because I know several nurses, and a lot of them have retired. The ones that have been in there for 20 plus years, yeah, they retired during this period of COVID, which continues to go on because they said they have never seen anything like this before. Many of them have told me that. It says illness has destroyed their lives and livelihoods. Workers blame lack of PPE. That was a big problem, not just in the UK, but in a lot of places in the early days of the pandemic. I do know some people who actually complained about that. So, yes, it was a big issue, and nowadays, I think it still is an issue. Why is it still an issue? There's not enough healthcare workers. There's not enough people in general using this protective equipment. Leave a comment down below if you've had to use healthcare and they're not masking. A lot of people can raise their hand and say yes to that. It is a real problem, and we could really prevent infections if we used high quality masking in healthcare. You heard me say that a lot today, and it's something that really bothers me because when I'm out doing deliveries, maybe sometimes I get catering deliveries, which I don't approve of, but hey, it's a job, it works, and I get there before they have their little function, and a lot of times it is going to medical facilities, and it just mind boggles me how many medical people do not mask. Masks do work. All right, moving on to this. Vermont Department of Health. COVID cases increased slightly. They still say they're low, and well, we know Vermont got hit very hard in the summertime. They got hit harder than usual. The number of reported COVID cases rose to 67 from 51 last week, and this story was published today. I don't know if this is the new update. It used to be Vermont updates on Tuesdays. I don't know if they still do that, but the latest number is 67 in Vermont, and the low was back in May, but we all know CJS was giving us the updates from Vermont during the summertime. You know, he posts his daily data, and Vermont got hit really hard back in the summertime and in September. They were having weeks where they were having near 10 deaths a week, which is really bad for Vermont standards. Now, here's something I did not know about. The pandemic death total in the state of Vermont is at 1,230 as of November 30th, 2024. Alrighty, moving on. Taking a look at air quality. And I can tell you right now, air quality has been bad in a lot of places. It's still bad in the east. We have this unusually warm setup today in the east. There's a lot of moisture in the air. A lot of different reasons why air quality can be bad in the east. And of course, on the west coast, it is wildfire season. Want to learn more about climate and weather? Climate Data Report is my other channel. I don't think I'll be posting a video there today. I will be getting something out there tomorrow. Taking a look at Philadelphia EMS calls yesterday. Yeah, 840 EMS calls, and back on Sunday they had quite a few calls as well. That was also over 800. What was that number at? That number was at 806, and I hate to report that we actually had a neighbor that made up one of those calls the other day. Not COVID related whatsoever, just old age. Unfortunately, very sad. But yeah, EMS calls in Philadelphia are back over 800 again, and hopefully it doesn't stay that way, but I got a bad feeling it may. Montgomery County right now, a bit quieter. This is Montgomery County, Pennsylvania. But earlier today, there were a ton of respiratory calls and a ton of calls in general. So yeah, things have really picked up and gotten busier. Taking a look at what's going on in Chester County, Pennsylvania, we see a whole bunch of things. We see stroke, falls, sick person, abdominal pain, back pain, unresponsive person again, cardiac arrest. That's not good. EMS standby. Again, earlier this list was longer as well. There were 5 sick person calls at once earlier. Yeah, not a good thing. All right, let's take a look at the hospitals in general in Pennsylvania, and don't be alarmed, or don't be surprised, I should say. You're going to see a lot of hospitals here that are now listed at yellow. There's good reason for that. The viruses in general are rising in the state of Pennsylvania. COVID, you'll see in a minute, COVID wastewater. Yeah, it's starting to rise in Pennsylvania. Now, what's this? Chambersburg Emergency Department is currently experiencing high volumes. Please be aware of extended delays. Oh, so you might want to avoid that. Maybe go down to Waynesboro, Wellspan, Waynesboro. Next town down. If you live in Chambersburg, Pennsylvania, you might want to go to the hospital in the next town down. Hagerstown, Maryland's coming up as green. Maybe you want to check that out as well. York, Pennsylvania, what's going on there? Oh my, look at this. The emergency room is on divert, behavioral health diversion. Yeah, they got all kinds of problems going on there, and, on and on we could go. There's a lot of hospitals here in yellow. Yellow means the hospitals are very busy. The emergency departments are potentially on divert. Red means there is no emergency department. So you're seeing red and you're probably thinking, well, isn't red worse? Yeah, that means there is no emergency department at some of these hospitals. Penn Medicine, Chester County Hospital. Wow, high patient volumes at this time. Even in the Pocono Mountains of Pennsylvania, that is having a problem with not just behavior health, but the emergency department overcrowding. And here's one of the reasons. We had an update from Pennsylvania Wastewater today. Yeah, not happy about this. There's not one county that's seeing a decrease or large decrease. There's quite a few that are seeing no change, and now we have the introduction of several counties that are seeing increases. And the counties are as follows. Armstrong County is seeing an increase. Indiana County, Pennsylvania is seeing a large increase in COVID detected in wastewater. Cumberland County, Pennsylvania is seeing an increase. Delaware County, Pennsylvania is now seeing an increase. Lehigh County is now seeing an increase. And Monroe County is seeing an increase. And this is within the last 15 days. Probably within some of these, there are probably some counties that are seeing short-term increases, which means we may see more wastewater sites turn orange or red on the next update. This is a big, rapid change. Not a good thing to see here in my state of Pennsylvania. Now moving on to Virginia, and in Virginia, it looks like influenza. Emergency department visits are starting to trend upward. COVID is stable at this time, and RSV is stable at this time. Overall, respiratory illness activity in Virginia is moderate and trending up at this time. This is for the week ending in December 7th. We should probably see another update for this, or maybe this is the update. Yeah, it probably is, because it includes data from last week. And you can see here, emergency department visits, they're starting to trend upward. And take a look at this. I find this interesting. They're showing percent of emergency department visits by age for diagnosed respiratory viruses. Yeah, look at this back in like October through December. 0 through 4. That's concerning to see that many. I mean, it went over 8% for the ages of 0 to 4. Really concerning to see that. Now, ages 5 through 17 did go up, and that's starting to go down. But now 65 plus and 18 through 64 is going upward. But to see infants and toddlers have a significant increase like that, you should be very concerned to see that. The fact that it is multiple viruses, and there can be many different reasons. We don't know. Did the mother who gave birth, did they have a COVID infection or something go on prior to the child's birth? Don't know. I'm not going to speculate. I'm not the one that should be speculating on that. But just know that is not good to see such a high percentage of such a young age. That is not normal. Or at least I don't think that's normal. Someone chime in down below if you have a comment on that. All right. Here's that surprise state that has a respiratory illness interactive dashboard. I was typing in RSV earlier on Google News. I got a story from Texas that came up, and then it said, click here for their dashboard or something. I'm like, what? Texas has a dashboard again? Yep, surprise. Here we are. And this is updated as of the end of November. Emergency department visits data. And it looks like they were trending upwards. They were up by 8.96%. Influenza went up by 32.74%. RSV, emergency department visits, went up by 41%. Now, I don't know what number that is rising off of, but that is a big increase. Hospitalizations for COVID were up by 12.5%. Influenza was up by 44.5%. RSV was up by 25%. And the good news is on the 23rd, COVID deaths did go down. But remember, COVID deaths are the last lagging indicator. So this is really interesting that they do have this dashboard. And the overall trend now in Texas is starting to go upward, which is something we don't like to see. In Canada, taking a look at the viral activity levels up there, and let's see, any changes? Well, COVID-19 is moderate, that stayed the same. Flu A stayed the same at low. Flu B still not detected, and RSV is running high at this time. All right, now let's take a look at a few of those Walgreens COVID positivity rates. Actually, first, let's do the national level. Nationally this week, COVID positivity is 15.2%. The prior week was 13.3%. That's a difference of up 1.9%. Testing did go up, and it's good to see testing up, but it's a shame that it always has to happen when we're seeing the increase from a brand new COVID wave, and that's what it is. 5,200 people got tested. Last week was 3,696. Now, taking a look at West Virginia, the positivity rate in West Virginia is 23.5%. The prior week was 16.7%. That's a difference of up 6.9%. Total tests, 17 versus 12. Going down here to Florida, because I don't recall if we did Florida yesterday. Okay, Florida had a significant increase in testing. First off, 9.1% positivity rate for COVID. The prior week was 6.9%. 537 tests versus 364, and that positivity rate still went up by 2.3%. I mean, I get it. Around the United States, the levels have been really dropped low this fall, but it would appear to me the rise that we're starting to see is starting to pick up the pace. It's coming in, and it's coming in fast. Taking a look at Louisiana now. Here's another example. 12.3% positivity rate. The prior week was 2.3%. Difference of up 10%. That's a double-digit number. 65 tests versus 44. I get it. They don't do much testing, but I mean, that is a really, like a light switch. All of a sudden, we went from bouncing off the bottom to boom, we're really starting to go up fast. And let's zoom in on the chart. You can see it here. It is really a quick turnaround. Thanksgiving did exactly what Thanksgiving was going to do, regardless of variants. Thanksgiving is definitely causing a surge in cases here in the United States. Indiana positivity trend, 20.8%. The prior week is 16.9%. Difference of up 4%. Total test, 120 versus 77. So even with testing going up, the positivity rates are still going up. Oklahoma, same deal there. 16.7% versus 12.2%. Difference of up 4.4%. Total tests, 72 versus 49. Let's go somewhere where positivity rate is dropping. And it would make sense. Oregon and Washington still are. They got hit super, super hard in the summertime. But at some point, they may turn around as well. First off, Oregon positivity rate is 3.8%. The prior week was 12.5%. Difference of down 8.7%. Total test 26 versus 8. And let's go back to the East Coast now. Take a look at New Jersey. And New Jersey, 15.5% positivity rate. The prior week was 11.9%. That is up by 3.6%. Total test, 148 versus 128. And you know what? We'll do one more. Let's end on a positive note. Since we talked about Virginia, let's look at Virginia. Virginia, 11.9% versus 16.5%. And that's a difference of down 4.7%. Total test, 118 versus 115. Now quickly taking a look at some wastewater data. And I got to show you something here. Wastewater scan tends to be a little wonky early in the week. This should get corrected later in the week. But you can see here, there was a wonky downward movement on the latest update. But prior to that, look what was starting to happen. And I get it. We're starting off from really low levels. Will we hit the levels of JN.1 we saw last winter? No, we will not. But at the same time, it doesn't mean this next month can't be really bad and we see a rapid rise. Because that is what was starting to happen on the national level for COVID. And you know what? It was also happening for RSV, influenza A, influenza B, yes, but that really is a low level. So not good to see. Norovirus, before wonky movement, was starting to rise even faster, and it was already above 60,000 pathogens, which is not good. Let's look at some individual wastewater sites, and let's go down to Louisville, Kentucky. We haven't looked there. I don't even remember the last time we clicked on there, and prior to a wonky movement or two, they were trending upward for COVID, and their levels are medium. RSV is low at this time. Influenza A is listed as high, but it is dropping at this time, and norovirus is listed as high at that site. Continuing on here, let's go out somewhere in the West Coast. I want to know what's going on in Los Angeles. Has Los Angeles started to rise yet? Well, at this wastewater site, and there's several, this is 3.5 million population. This is huge. If you see that starting to rise, it's not a good thing because it's a really big sample size. So it is rising slightly, but it's not seeing a rapid rise, not just yet. RSV at this time it's listed as high, but if you look here on the chart, it looks low to me. I don't know why they categorize it as high. Influenza A was rising. Now it is finally dropping. Influenza B, not much of an issue. HMPV not being detected on here. And norovirus is rapidly rising at this time. Hepatitis A has been showing up several times. All right, moving on. We do have some more things to take a look at. And next off, that would be New Jersey. And there have been some hospitals in New Jersey with problems. Mannington is having a specialty issue, a surgical divert. Mullica Hill is full and total divert due to patient volume at this time. And those are the only two hospitals. There was a third one listed earlier. It looks like that had cleared up. In New York State, 460 new cases are reported, and the hospitalizations, they did go up again. They're starting off from very low levels, but they are once again rising. 497 hospitalized, 53 people in the ICU. And let's take a look at hospital admissions and see what that is starting to do. And there is definitely a noticeable increase in hospital admissions. They start this week off with 217 people admitted on this update. Taking a look now at the latest variant of COVID that is dominating, and here it is, and that is the XEC variant. The XEC variant does lead the way in the United States at 44%, and KP.3.1.1 is at 39% at this time. Now, there is another variant out there, and it's not listed on there. Matter of fact, I don't remember what it is off the top of my head, but I've been seeing a few people talk about it, how it is starting to quickly rise around the world. That could be the wild card in this winter wave. Does that come into play before this wave ends, or is that something we have to worry about down the line? Don't know, but hey, just thought I would bring it to your attention. I'll try and get that in the next update if I can, if I see more about it, which maybe tomorrow, Maybe Friday? I don't know. I got a feeling we may be back here again tomorrow doing another update. If you enjoyed today's update, give it a thumbs up. If you're new to my channel, subscribe down below. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. I will see everyone again next time. Until I see you again next time, stay safe. And remember, even just a mild case of COVID can cause you to go on and develop long COVID. So please, don't go out there and say, oh, it's not going to be that bad this year. No, one case is all it takes. Okay? Thanks for watching. See you again next time.